and welcome to Popcorn with a Program. Today we are in the program faculty and staff room. We have a few programs with us that are going to share some information. My name is Julia Majalca. I'm your moderator for today. And we have dental studies, nursing, pharmacy technology, and respiratory therapy. So we'll go ahead and get started with dental studies, who will be sharing some information from their website. So I'll go ahead and stop share.
Take it away, Holly.
Hello. Okay. Well, I am Holly Houck. I am the department head for dental studies. And dental studies encapsulates three of our programs. We have dental assisting, dental hygiene, and dental lab tech. So I'll go ahead and just share my screen here and see the different web pages for our programs. So one of the first ones is dental assisting. This is a certificate program. It's a 9-month program. And all you need is a high school diploma or GED to be able to apply for this program. I think there's just a reading placement prerequisite to do the dental assisting program. The dental assistant is someone who works chair side, hand in hand with the doctor during any sort of treatment procedures. So restorative as far as getting fillings done, having a crown done, extractions, root canals, those kind of things. They're kind of the dentist's right-hand man when they are in there assisting with the doctor. Dental assistants can take x-rays, they can take impressions, they can assist with hygienists doing coronal polishing, and there are also opportunities for them to enhance their skills and do what's called EFTA and become certified to do some limited restorative work. So that's kind of exciting, something that dental assistants can do. Our other program is dental hygiene. Where did I go? That's the clinic. There we go. Dental hygiene. This is an Associate of Applied Science degree. It is a 2-year program when you start the program. There are roughly up to about 2 years of prereqs prior to coming into the program. So there are specific science, chemistry, anatomy, physiology, those kind of courses that need to be taken prior to applying for the program. So there is a pretty lengthy wait list for our program at the moment. We really tell students not to fret too much about it because how things kind of play out, it's usually about a 2 to 3 year wait on the list at this time. A lot of times students will plan to do the dental assisting program while they're on the wait list for dental hygiene. So that's a great way to kind of bide the time, get your feet wet into the dental realm, learn the terminology and different elements of the dental field. So the dental hygienists, they are the prevention specialists. They're the ones that when you see to come in and have a teeth cleaning, we do all of the different preventative therapies. We work with the doctors to come up with preventative treatment plans. We work with treating dental disease as far as the gums and keeping the health of the bone that's surrounding the teeth. So that's the important job of a dental hygienist. We're kind of in our own little realm a little bit in the office. We do work hand in hand with the doctors and the assistants, but not in the direct modality that the dental assistants do. One of our other programs is dental, dental laboratory tech. We are transitioning this program. So there are some new things coming up with this, but these are the ones, they don't work direct in an office. They work by making the items like a crown, dentures, things like that in the background. And one other piece here is we do have a dental clinic on the West Campus. We do serve the public here. Our 1st and 2nd year dental hygiene students do see patients and provide preventative treatments and therapies. And it's very low cost. There is a time trade-off there for the low cost for care, but it's a great way to see what we do in our facility. I'm just going to pass it to Carolyn real quick if she had any few last minute quick things to add.
One thing that we have just added is if you take some specific courses in the dental assisting program, which would be oral radiology, lecture, and clinic, and then dental materials lecture and clinic, and you are successful and you're a graduate from the Pima dental assisting program, you don't have to repeat those courses in the dental hygiene program. We'll actually honor those in our hygiene program, which is really excellent because a lot of our students will also be dual enrolled at NAU and getting their bachelor's degree concurrent with their associate degree from the college. So that's a very exciting addition that we have. Expanded functions, I just wanted to mention that quickly. You're not limited to the 2 years and what you learn or the 9 months in assisting to what you learn. There are many, many things that we do, suture removals, anesthesia. There's a therapy now where you can fill fillings. So it's really a growing field and very exciting and a great way to work with the community and make people happy and healthy.
Great. Thank you so much, Holly and Carolyn. That was wonderful to hear. Next up, we have our nursing program who will be sharing a presentation. So for nursing, you have until 3:37.
All right, thank you guys. So my name is Amanda Hogan. I'm joined with Dede Denogean. We're the program managers for our nursing programs that are at the college. And we just wanted to walk you through quickly all the different options that we have. So I'm going to turn it over to Dede and let her walk you through our CNA and LPN credit programs. And then she'll turn it back over to me and I'll talk about our associate degree and BSN options.
Thanks, Amanda. So Pima Community College offers a couple nursing entry programs, the nurse assistant and the licensed practical nurse program. Both of these are great opportunities to get into a license or certified healthcare job quickly. The certified nurse assistant, the admission requirements for that is placement scores, or you can meet it through course proficiency. You would need to meet the clinical eligibility requirements. The admission requirements for this program is first come, first serve admissions. We do 6 to 7 cohorts in the fall. We'll do about 4 cohorts in the summer. We have them at mainly our main campus is Desert Vista, but we do run cohorts in Nogales and Cells and Pascayaki. We hold cohorts there. So all around Tucson. The program runs 5 to 10 weeks, really depending on which cohort that you pick. You can do a Monday through Thursday, Friday, Saturday, Sunday, an evening cohort. It all depends on if there's a holiday that falls in there. We hold our own monthly information sessions. They're found on the Pima event calendar. So we hold 4 of them a month. So, and you can find all of our nursing information sessions there. We would recommend that you come to one of those and get more information on our programs. Our licensed practical nurse program, admission requirements is placement score or course proficiency. You need to meet clinical eligibility requirements. Again, it is first come, first serve admissions with an application checklist. We don't want you to fill out the application without coming to an information session. The program runs 12 to 13 months, all depending on your status when you enter the program. And hospitals are starting to hire licensed practical nurses now. So just in case you were thinking, you know, I don't want to work just in long-term care, as a CNA and an LPN, you can actually work in the hospital. And then again, we have those monthly information sessions. Please come to one to get more information. I'm going to go ahead and pass it over to Amanda so she can talk about our ADN program.
Thank you, Dede. So we also host or hold an associate's degree nursing information session. We host those twice a month as well, where we walk you through our preparatory coursework, our nursing entrance exam, and the competitive admission rubric. The nursing program no longer has a wait list. We haven't had a wait list for a while, but we do have some specific things that we look at to help you get admitted into the program. We do have spring and fall admission. We have 120 students start every spring, every fall. And we do also, in addition to our associate degree in nursing, have concurrent enrollment options with BSN and MSN through ASU, NAU, GCU, the University of Phoenix. Like Dede said, we're in the hospitals, we're in long-term care facilities. Our students we love that they get into the clinical environment within the first few weeks of pretty much all of our programs. So it's like a job interview the entire time that you're in our programs. And we have 100% higher rates for all of our students. They typically have job offers in their third and fourth semester. And to be the most successful in these programs, we just find that our students will have flexibility within their work life, home life, and school. If they can balance all of those things, they're typically, the most successful in our programs. If they stumble and they have any of that kind of time management come up, our faculty definitely steps in and helps them kind of balance that out, figure that out. I was going to say, I hit my mark. I hit my 37. So please come to our nursing information sessions. We would love to give you more information and go over everything in detail.
Thank you so much to Amanda and Dede. And now we are going to move on to our pharmacy technology program. And so we have them going to share a little bit more information about the program.
Okay. Hi, my name is Majalca. I'm the clinical coordinator for the pharmacy technology program. We're not actually just out there counting pills. We're the second set of eyes for the pharmacist. We are talking to the clientele, depending if you're retail or hospital, different clientele. Sometimes we're talking with the doctors. There's lots of different things that we do out there. We compound, we do sterile, sterile, non-sterile compounding, veterinary, nuclear. We do a lot of different things. We cover a lot of these in our courses, and we are able to get our students out in 2 semesters. 85% of our coursework is online, 15% is in person. Our labs are only on Wednesdays on campus, but then there is an externship where you will be half of it, 120 hours in retail, and then the other half, 120 hours out in the hospital. We have 3 start times a year. We start summer, fall, and spring. Our requirements to get into the program is to get through Math 92 and Reading 91. It's a first come, first served basis. You attend a program orientation. Once you have met all the criteria, you are set to start the program. And once you are finished, you are ready to sit for the national exam. If you are interested in the program, reach out to Susi Schmidt and she will get you signed into one of the new student orientations.
All right, well, thank you so much, Dawn. We appreciate that information. So Susi, information is right up on the screen right now. So if you would like to contact her, you can find it there. And then our last program for today is going to be respiratory therapy.
Thanks, Julia. My name's Russ Schmidt. I'm the program director for respiratory care. And the respiratory care program graduates respiratory therapists who take care of patients who have lung and heart disease, like COPD or asthma or heart failure, for example. We take care of those patients either in the hospital setting. We also see patients in physicians' offices and urgent care centers and long-term care facilities. We also, you'll see us also in positions of supervisory positions throughout the hospital. And we also work in sales too. pharmaceutical and equipment sales for the equipment that we actually use in the profession. Long-term, our home care is one area that we work in. We also work in sleep labs, diagnosing sleep apnea and other types of sleep disorders. Our program is 2 years long. It's actually 5 semesters because we have a summer semester that bridges the 2 years. The first year is Monday through Wednesday, and it consists of lecture and lab. That summer semester, you'll go out into clinic and begin practicing the things that you learned in the first year. The second year is a little bit more intense. It's Monday through Friday. We have 2 days of clinic in the Monday and Tuesday of the week, and then Wednesday through Friday is lecture and lab. Also, your second year is when we do our specialty type of training, like neonatal and pediatrics. And we also do a comprehensive review that prepares you to take the National Board's credentialing exam. So once you graduate from the program and have your associates, and then have your credential, then you're eligible for licensure, and then you can work as a respiratory therapist throughout Southern Arizona, the state of Arizona, all 50 states, and even some US territories and foreign countries. We also encourage our students to enroll in a concurrent baccalaureate program. Right now, we're partnered with Northern Arizona University. So again, if you have aspirations for advancement in the career, in other words, going into supervisory positions or hospital administration positions, then you'll want to get the 4-year degree. And then that will kind of be the key to those types of job positions. And that's the respiratory care program in a nutshell.
All right, thank you so much, Russell, for sharing that information with us.